Good afternoon. So I will be giving a talk today about whether or not we have reached the so-called 90-90-90 treatment targets in Europe and Central Asia. So this is the outline of my talk. I will start by giving you the context of HIV in the context of the SDGs, so to speak. I will then go on to give a brief overview of the epidemiology of HIV in Europe. I will focus my talk on progress towards achieving the so-called 90-90-90 treatment targets, and then try and answer the question towards the end, whether or not we're on track to end AIDS. So these are the Sustainable Development Goals. You're all very much aware of those. Goal 3 is related to health, and Goal 3.3 is related to infectious diseases, where it says we should be ending AIDS by 2030. So UNAIDS is tasked to define what ending AIDS means, and they have defined it as 0 new infections, 0 deaths, and 0 discrimination by the year 2030. And in order to achieve this, they've developed so-called fast-track targets, where they want to see a reduction in new infections by 500,000 by 2020, the same amount of deaths by 2020, and to eliminate HIV-related stigma and discrimination by 2020. So when it comes to specific targets for Europe and Central Asia, we have quite good measures as it comes to incidence reduction and to the so-called 90-90-90 treatment targets. When it comes to PrEP, mortality, and stigma, the data is much more difficult to assess, but I'll be focusing on incidence and especially the 90-90-90. So as you know, we do joint HIV surveillance together with our colleagues at WHO Europe, and this is the latest report from 2019. As you see here, 142,000 people were diagnosed with HIV in the wider WHO European region in 2018. 16% of these diagnoses occurred in the western parts of the region, these countries in green, 5% in the central parts of the region, and a full 79% in the eastern parts of the region. You see at the bottom of the bubbles here, you see the rates per 100,000 population, and you see how much they differ compared to the eastern parts of the region, where we have a very high rate of infection. In terms of transmission risk by sub-regions, you see here for the West and Center, they're quite similar, where approximately half of all diagnosed cases occur among men who have sex with men, followed by heterosexual transmission, and approximately 4% of diagnosis among injecting drug users. In the eastern parts of the region, a very different pattern, where the majority of cases are diagnosed among heterosexuals, a significant proportion among injecting drug users, and only 5% among men who have sex with men. A big issue here is the issue of migration, of course. In the western parts of the region, almost half of all diagnosed cases occur among those who are born abroad, as we define as migrants, 10% in the central parts of the region, and only 1% in the eastern parts of the region. So that's a big distinguishing factor in terms of transmission risks. This shows you HIV diagnosis by route of transmission in the EU countries. And what I do want to point out is this issue where we're seeing a decline now in HIV diagnosis among men who have sex with men, which is very positive. We've not seen that for the past decade, but the past 2-3 years, we're seeing a decline. It's not in all countries, it's in these countries, European countries, where we see a specific decline. And we're trying to understand what kind of things they're doing right in terms of combination prevention, that we're seeing these declining trends, very positive. So let's move now to the 90-90-90 treatment target. So this is what it looks like. Target 1 is about, we want to see a 90% reduction. We want to see 9% of all people living with HIV diagnosed. Out of those diagnosed, we want to see 90% of those on treatment, and 90% of those on treatment, we want to see virally suppressed. If you reach these 90-90-90 targets, we'll have at least 73% of all people living with HIV who are virally suppressed. And according to UNAIDS modeling, this is what will set us on track to meet the SDG targets. So let's start with target 1. Where are we in Europe? So here we see 43 countries are able to provide data to ECDC on this. So as you see here, 80% of all people living with HIV in Europe and Central Asia know that they are HIV positive. So the green countries here, the green bars indicate countries that have reached this target already. The bars in blue indicate countries that are above the regional average and which we think are on track to meet this target by 2020 or close to. And those in orange are below the regional average, and some of them, especially to the right-hand side, are very far away. There is sub-regional variation, of course. You see here in the western parts of the region, 87% of all people living with HIV have been diagnosed. That drops to 76% in the eastern parts of the region. And within the regions, you see ranges that are important to notice, that there are some countries in the east that are doing quite well. So those were the people that were not diagnosed, but out of those that are diagnosed, we see a significant proportion who are diagnosed late, 53%, and this has not changed so much over the past decade. You see here in the subcategories in green, people diagnosed in the eastern parts of the region are more likely to be diagnosed late than those in west. Women diagnosed later than men, those older are diagnosed later than those younger, etc. So what do we do about late diagnosis? Well, what we really want to do is reduce the time from HIV infection to diagnosis. And we've done some modeling around this in the EU countries. And we've estimated that the median time from infection to diagnosis is 2.9 years. There is a difference within EU countries as well. Those countries in the northwestern parts of the region have a shorter median time from infection to diagnosis compared to those in the southeastern parts of the region. Okay, let's move on. Once you are diagnosed, are you receiving treatment? So we have 45 countries that are able to provide data around this. Here you see the overall percentage is 65% that are on treatment out of those diagnosed. This is a drop. The first target was 80%. Here it was 65. So a number of countries, again, significant number of countries have reached this target already. Most of these in the western parts of the region. A number of countries in the eastern parts of the region are very far away from reaching this target. Again, we see significant sub-regional variation. In the west, we've reached this target already, dropped to 75% in the center, and less than 50% of people that have been diagnosed are on treatment in the eastern parts of the region. But again, there is sub-regional, within region variation here. That's important to point out. So treatment policy is really important, of course, and it affects the number of people on treatment. And we've monitored this over the past couple of years. Here you see in 2014, most countries started treatment at 350 cells. And this was according to national and international guidelines at the time. But with the release of the START trial, both the European AIDS Clinical Society and WHO changed their policies, or recommendations rather, to recommend test and treat. And very quickly, countries in 2016 adopted these policies. And in 2018 now, most countries actually have adopted these policies and have a test and treat policies. But there's one thing to have a policy in place. There's another issue in terms of implementation, and I'll come back to that shortly. However, there is one issue I want to talk about, and that's availability of treatment for undocumented migrants. And you see on this map, more than half the countries in Europe and Central Asia do not provide treatment to undocumented migrants. So there will be one subgroup in Europe that are not going to be achieving these targets, and that's undocumented migrants. So let's move on to the third target. So once you are on treatment, are you reaching viral suppression? As you see here, the overall percentage is 86%. So we've pretty much reached this target as a region as a whole. But again, there are countries in the eastern parts of the region that are quite far away that we need to be supporting. So these are the three targets. Now let's look at those countries that have data across all these three targets and see if they're reaching the 73%. So overall, 44% of all countries that have data of all people living with HIV are virally suppressed. You see 9 or 10 countries have reached this already. I would say from half of the countries on this list, from Slovakia onwards, they're going to be having major challenges in reaching this target going forward. But it is important to say that there is evidence coming out that the 73% target may not be enough. Andrew Phillips and colleagues are making the point here that to see a significant reduction in HIV incidence among men who have sex with men, we probably need to see a 90% viral suppression rate among this population. So we're very far away from this region to be seeing this. So it's a big challenge that we have in front of us. So there are significant sub-regional variation as well overall. In the West, again, we've reached this target already. We're at less than 50% in the central parts of the region. Only a quarter of all people living with HIV have reached viral suppression in the eastern parts of the region. So I focused on those that are virally suppressed. What I want to do now is look at the other people who are not virally suppressed, those people who are living with transmissible levels of virus. So we estimate, based on the data we get from countries, that 1.2 million people are living with unsuppressed virus. If you live with unsuppressed virus, you belong to one of three categories. Either you haven't been diagnosed, the red bar or the red box here, or you've been diagnosed but not yet on treatment, or you're treated but not yet had time to reach viral suppression. In the West, we see here that the 200,000 people are estimated to be living with unsuppressed virus. Half of those are estimated to belong to this undiagnosed category. So testing is going to be critical for this group. In the center, 20,000 people are estimated to be living with unsuppressed virus. Here we see a more even spread among the three categories. And in the eastern parts of the region, 56% of all people, of the 1 million people almost who are living with unsuppressed virus, belong to this second category, that they're diagnosed but not yet on treatment. So it's implementing the policies that we have in place will have a huge difference on the epidemic in our region, especially in the East. So to conclude, are we on track to end AIDS? So here you see where we are overall. 80% of all people living with HIV in our region have been diagnosed. The target is 90. 50% are on treatment and 43% are virally suppressed. Now, UNAIDS this summer pushed out new data showing that the global ART coverage is at 62% globally. And in Europe, we're at 50%. So we're below the global average when it comes to putting people on treatment. And that comes as a shock to some people, but not everyone, of course, you know this. But again, there are significant sub-regional variations. In the West, we've pretty much reached these targets already, or almost reached all three targets. But when it comes to the center and east, we have major challenges, and especially when it comes to the issue of treatment, where we see a big drop-off, especially in the center and the east. So how are we doing that? Because of these differences, let's look at the incidence target. So the fast track target suggests that we should see a 75% reduction in new infections by 2020 using 2010 as the baseline. So here's the baseline. So here you see in the red line, you see the full WHO European region, and the green line only looking at the EU countries. In the wider region, we see actually a 28% increase over the past 8 years and a 13% reduction. And this is where we need to be in the next 2 years. So it's quite clear that we're not going to be meeting this target in Europe or Central Asia going forward. So to conclude, we will not be meeting these targets unless we address the following gaps. So we have a prevention gap. So we need to scale up needle and syringe programs, opioid substitution therapy, as well as PrEP throughout the region. We have a testing gap. 1 in 5 people in Europe are unaware of their HIV status. We have very low coverage of testing in certain parts of the region, and that manifests itself in the fact that we have 1 in 2 people who are diagnosed late in our region. That number has not gone down. And then, of course, we have a treatment gap where only 50% of all people living with HIV in Europe are not on treatment. So I want to acknowledge all these surveillance focal points in Europe and Central Asia, as well as colleagues from ECDC, WHO, Europe, UNAIDS, and our consultant team. Thank you very much.